welcome. You're watching NewsX, medically speaking, and I am Meenakshi Upreti. Now, it was a very significant day, a day which many of us would have ignored simply because of lack of awareness. I'm talking about World TB or World Tuberculosis Day. Many of you may say that you've seen multiple government ads, you have seen advertisements in newspapers, but despite of that, believe it or not, there is a massive amount of lack of information regarding TB. Today, we will try to dissect really what this disease is, what the symptoms are, if there is any prevention possible, and we will also look at specific TBs of various parts of our body, some which many of us perhaps have never heard about. To talk about this in greater detail, I'd like to welcome my panel of experts. I'm going to start first of all with Dr. Rajesh Chawla. He's a senior consultant, pulmonary and critical care from the Indraprastha Apollo Hospital. I also have Dr. Lavindra Tomar. He is the head of ortho and bone replacement at the Max Hospital. Then we also have Dr. Sunil Mandhania. He's a senior consultant, also known oncologist. He's joining us from Nagpur today. We have Dr. Suman Lal. She's a senior consultant of gynecology with us. And we also have Dr. Disha Bhatia. She's the national head of microbiology at the core Diagnostics. I'm going to start first of all with you, Dr. Chawla. Sir, if you could help us understand in very simple terms, very simply, what is tuberculosis? What are the symptoms? How can one suspect that they have TB? When is it that they need to go for a checkup? Because end of the day, early diagnostic is the key, isn't it, sir?
Tuberculosis is caused by a bacteria which is called the Mycobacterium tuberculosis. When you come in contact with a person who has tuberculosis, so when you talk to him, when you spend time in the close proximity of that person, when he talks, droplets keep on coming, and then they are inhaled by the person. And then depending on the immune system of the body reacts. If there are 10 people infected, then 10 out of them will get tuberculosis in their lifetime. Every person who gets infected doesn't get tuberculosis. In 90%, you can say that body is able to overcome, the immunity is able to overcome. In some persons, the TB can appear at the same time. In the other persons, the TB bacteria can remain in a dormant stage. And when the immunity goes down, they can multiply and cause disease. And these are called primary and secondary tuberculosis. And when a person, and the TB can occur from any organ. You can have a TB in the brain, TB meningitis. You can have TB in the lung, TB. Almost all organs of the body can be infected. Even the intestine can have TB, skin can have tuberculosis.
Yes.
Lungs, of course, the bone can have tuberculosis. So TB can infect any of the organs. Most of the time, what happens is that when a person gets infected for the first time, through the blood, it goes to that organ, remains dormant there. And again, when the immunity goes down, there is a trauma, then these reactivate and cause tuberculosis. These patients will have cough with sputum, fever, and bleeding. These are very non-specific symptoms pertaining to the respiratory tract. When these are present for more than 3 to 4 weeks, one should suspect that there could be a possibility in a country like India where there is a high prevalence of tuberculosis, there is a possibility of tuberculosis.
Right. And sir, I'll come back to you. Since you spoke of multiple aspects, of course, the most significant and known manifestations, of course, a cough, which persists more than 3 weeks. And we'll speak about it specifically in today's time, in a post-COVID pandemic, if I could call it that, as of now, the scenario, sir. But you also spoke of various tuberculosis of various parts of the body. And we have experts who are going to perhaps shed more light on it. So to go to Dr. Tomar. Dr. Tomar, you're the head of ortho, bone replacement, your specialty. Help us understand really a little more, shed more light on bone tuberculosis. What exactly, is it? How is it different from, of course, the other, TBs which affect the other parts of our bodies?
Very nice question, Meenakshi. Actually, as far as tuberculosis is concerned, as Dr. Chawla rightly told us, that it is caused by Mycobacterium tuberculosis, and most of the our people understand that tuberculosis is confined only to the lungs. It causes cough and blood vomiting, or cough, blood in the cough, and loss of weight and other things. But it is not like that. Tuberculosis can affect any organ of the body, as rightly told by Dr. Chawla. Like, it can affect the brain also, it can affect the skin, it can affect the various organs of the body, and the symptoms are accordingly. Like, if it is intestine, so symptoms will be according to that. It will not be cough. As far as bone is concerned, so bone, this almost all populations suffer with tuberculosis, either with some infection or with the vaccine. That vaccine that we get is live attenuated vaccine. So there is always a primary focus which remains dormant. Then secondary tuberculosis, as in the lungs, and then the tertiary tuberculosis. Usually the bone tuberculosis is tertiary tuberculosis. It can affect the long bones, thigh bones, it can affect the joint, it can affect the spine also. Spine tuberculosis is also very common. Joint tuberculosis in the smaller joints, in the knee joint, in the hip joint, the tuberculosis is very common. And whenever the painful, when there is any pain in the bone, pain in the joint, so first differential diagnosis is always tuberculosis in India. However, in developed countries, it is not like that. It is the last differential diagnosis. But in our country, because the prevalence of tuberculosis is very high, so the first differential diagnosis is to be kept infection tuberculosis. And then the joint, if swelling is persisting, the pain is persisting, and it is not relieving by normal painkillers, then there is a likelihood of tuberculosis is there, which has to be confirmed with various investigations, with tissue diagnosis, or some scanning, MRI scanning, etc. And the most common problem that we face nowadays is, like we have been doing in the elderly patients who already having pain in the joints, knee ka osteoarthritis ho raha hai, hip ka osteoarthritis ho raha hai, and then we operate because it is age-related osteoarthritis. We replace the joints, but sometimes these have got the coincidental infection of tuberculosis. So while doing surgery, we send the tissue for biopsy to rule out the tuberculosis, because when we operate, most of the almost 99% cases are okay, but 1% may not be relieved of pain with coincidental tuberculosis, which we can rule out by doing the tissue biopsy at the time of surgery. So tuberculosis incidence is very, very high in our country. It is quite common in bone as well, in the joints, all the bigger joints, smaller joints, and all the bones. So after,
yes,
yeah.
so you spoke about on how common tuberculosis is in our country, and you also spoke very interestingly about how at a later stage sometimes you get to know that a patient perhaps is suffering from tuberculosis, which makes, of course, matters more complicated. Dr. Mandhania, so there was a very interesting piece which I came across, and this has been told to me by many doctors. Many of them could be your ex-colleagues from AIMS as well, who were speaking about how there is a difficulty and there is a sort of lack of knowledge within the community as well when it comes to diagnosis of tuberculosis. Sometimes it's diagnosed as cancer, and it's really this wrong diagnosis also which is causing a big problem. Could you shed a little more light on that front? What really is the correlation, and what can happen if a correct diagnosis is not made at the right time?
That's a very good question, Meenakshi. What I feel is we had a lot of instances of misdiagnosis, malignancy with TB, and vice versa. Tuberculosis being diagnosed as a malignancy, or malignancy being diagnosed as tuberculosis. You have to understand these diseases have more or less same overlapping symptoms. I will give an example. If the patient is presenting with the chest pain and cough and pleural effusion, that means fluid in the lungs, so most of the time in Indian scenario, it is TB, and TB unless proved otherwise. But the caveat lies here. So we cannot start any treatment empirically, because I had seen a lot of patients being treated empirically. That means without any tissue diagnosis or without getting a cytology. And what are the problems in cytology? I will again tell you this. So these patients being started with that anti-tuberculosis treatment, and they come to us after nearly 1 month, 2 months, or 3 months. when the disease has already progressed and the patient has not responded. So the problem here is that we should have a proper tissue diagnosis. That is very important. Second important thing is in the case of pleural effusion, that means fluid in the lung, the common mistake I had seen is they generally the fluid which is sent for the diagnosis is just 10 ml, 20 ml. You can imagine a lungs having a 2 liters of fluid, and we are sending, we are tapping 2 liters also, but we are sending just 10 ml. So the problem here is the most important thing is it should be fresh, it should be large volume, and at the same time there should be 2 drops of heparin should be kept in this, because the clumping of the RBCs takes malignant cells with them, and that's why generally we get a negative diagnosis of malignancy, though it is a cancer. So these are the common mistakes which we see. And secondly, we can see generally this tuberculosis can present in a very, very different way. And it's a magic disease also, because it can present in brain, it can present in lung, it can present in nose, it can present in rectum also, it can present in abdomen. So the suspicion level should be very high, and it should be always the crux of the diagnosis will be to get a tissue diagnosis, because generally I will give an example. We had one patient of 19 years with a mass in the rectum, and it was diagnosed as cancer. But when we got the biopsy, it was tuberculosis. So these are overlapping things. Yeah.
So you spoke of the significance of diagnosis. It's only fair that I get Dr. Bhatia as well. Dr. Dishra Bhatia, as the national head of microbiology from Core Diagnostics, has helped us understand a little more about the significance of early diagnosis. I believe you've been speaking on the future of diagnosis as well, especially when we speak of tuberculosis.
Right. So there are a couple of diagnostic modalities for diagnosing tuberculosis, and unfortunately, in even amongst clinicians, there is sometimes lack of clarity as to which is the best test to go for to diagnose TB, especially in smaller remote areas and rural areas where still a lot of staining is being relied upon. That is your, looking for acid-fast bacilli on microscopy, which is not very sensitive. We have very sensitive techniques now. So the gold standard for TB diagnosis is culture. And for that, we have liquid culture, which is faster and better than solid culture, but still takes a lot of time. It takes many, many weeks to get that diagnosis. We generally do not have that kind of luxury to have that kind of time to diagnose TB and start treatment on time, and sometimes patients are lost to follow up. So for that, molecular diagnosis is a real game changer. So we all have heard of GeneXpert, which is widely available in our country also now. So we need to increase the increase testing for GeneXpert. Instead of relying on the older techniques which are not sensitive, GeneXpert is really sensitive, and they've come out with newer forms also, which in a single test will tell you the diagnosis of TB as well as the presence or absence of resistance. So it will tell you if that particular strain is resistant to rifampicin, and now the newer versions will also tell you about other drugs. So in that one visit where the patient contacts the healthcare worker, you will get to know whether or not he has TB and what drugs to start for that patient. So that is one. And the second is, as the clinicians rightly mentioned, that it's not always pulmonary TB. TB can be of many parts. So then getting a targeted sample is very, very important.
Okay, targeted sample is very important. Point taken. I'll come back to you. Let me bring in my other guests as well, Dr. Suman Lal. Since we're speaking of targeted checking, we're speaking of course, tuberculosis, which affects various parts of our body. There is genital tuberculosis as well, something about which there is a very less level of awareness, and not much, is known about the same.
When we talk about the genital tuberculosis, basically what happened when the tuberculosis occurs in any of the women in the lung or in the abdomen, it goes through the blood or lymph in the genital area. It may affect fallopian tube, may affect the uterus, may affect the ovary, and it can cause lots of problems. The patient generally present with a white discharge, irregular bleeding, chronic pelvic pain. They take it as simple infections, and they generally don't go to the doctor. But they come late, and at that time, generally they have lost their viability of the tube, and mostly they remain infertile. So therefore, it's important to diagnose the tuberculosis, genital tuberculosis in the early stage, and to treat the early stage. If we treat the tuberculosis by the medicine, and it will be treatable and curable in the early stage, but if we leave for some time, it will damage the end organ, then it will be very difficult to treat and make them pregnant.
Right. So it's basically the early diagnosis, which is very important. But if you look at the numbers as well, and Dr. Chawla, could you, you could come in here, sir. I was going through some numbers before, we began the debate. Tuberculosis cases in India, 2016, it was 19 lakhs, 2018, about 21 lakhs. Till 2020, it was again about 18 lakhs. So the number of cases very, very high. Help us understand why the numbers are so high. And since you specifically spoke of symptoms, of course, the most common being a persistent cough for more than 3 weeks, help us understand if there are any preventive measures. Of course, we all know about the BCG vaccine, but anything over and above that.
See, I think, as I told you, when the person gets infected, a lot of people retain these bacteria in the dormant stage and they get reactivated. So that is why the government has been trying very hard to control tuberculosis, and they have different components to control the tuberculosis, but they have succeeded partially, and their aim is by 2025 to reduce it significantly in India. As far as the prevention is concerned, one is if a person around you is coughing for a long time, he must get tested. The main problem is the people who keep on coughing and don't get tested. And by the time they get tested, they've already spread to others and their disease is also quite advanced. So have a high suspicion. If your symptom persists for a long time, you must get it tested and you must treat properly, because most of the damage they do before diagnosis to others. Once they're diagnosed, most of the time, those people would be careful and they would not spread to others. So one is that. And you control, if your immune status is low, then you take care of that. Like if you are a diabetic, control your diabetes well. In diabetes, the tuberculosis is high, and tuberculosis also leads to the poor control of diabetes. So you should control your diabetes. If there's any other thing which can be treated, you should treat yourself. And the most important thing is if there are people who are suffering from tuberculosis, they should take the drug properly. And there is a minimum treatment for tuberculosis is never less than 6 months. So many times these people stop treatment before, and then their tuberculosis not only become resistant, it causes harm to others also. And they suffer for a long time. Sometimes it can result in death also. 5 lakh people in India still die of tuberculosis every year. In spite of having good drugs, in spite of government having so many control centers, in spite we know everything, still people die. So important is to diagnose. The BCG vaccination, of course, has been done, but it has not been able to control tuberculosis. So controlling tuberculosis well is, I think, single most important preventive measures. And if there is somebody in the house, till he becomes negative, he should take care. He should wear a proper mask. Nowadays, people are used to wearing masks rather than previously they used to wear handkerchief. They should dispose of their sputum well, not throw sputum here and there because it can harm others. So all these things can help in preventing infection to others.
Right. And so since you spoke of masks, and that was a question actually initially I wanted to ask you, and you just reminded me of that, I'll take it to Dr. Tomar. Dr. Tomar, after COVID cases have started abating, I don't want to call it a post-COVID pandemic world because we don't know where COVID is going. Cases certainly are low, but the World Health Organization has basically said that the pandemic has reversed all the progress which was made in combating TB for years by various global organizations, by the world. Help us understand, what do you think really has been the impact of COVID on tuberculosis, sir?
The two things are very important in controlling tuberculosis. The one thing is to prevent the infection. Like if one person is infected, the infection could be prevented by various measures. So during COVID times, because of mask and because of the much emphasis was given to increasing the immunity. So both of the things helped in preventing the spread of tuberculosis. So we were presuming that the tubercular infection the incidence will be less. But the one more important thing is continuation of the treatment. If somebody is already infected with tuberculosis, that the treatment has to be continued, say for minimum in bone cases 1 year, maybe 1.5 years, and in pulmonary cases for about minimum 6 months. So most of the people they basically stop the treatment in between, and that is very, very harmful. Like if somebody is treating treatment in between, because treatment is expensive also, and not all the patients were having access to the government programs. So whenever you stop the treatment, the likely chances are there that the patient will have infection again, and he is likely to spread this infection amongst his family members, amongst his friends, and whenever whomsoever the patient is meeting. So that's why the infection incidence has become higher, because they stop the treatment in between.
Okay, I get your point. I think Dr. Chawla also sort of emphasized on the same, but Dr. Mandhania, it's interesting to see the Dr. Tomar, and I agree with his point to a certain extent that yes, COVID pandemic has increased awareness about immunity. Mask wearing has become common, but certainly it has some ill effect as well. I can give you personal examples of people I know, and I hope they don't have TB. We don't know yet. They have had persistent cough after recovery from COVID, but they just don't want to go for a TB test because they're calling it the so-called ill effect of COVID. I'm sure you're coming across, similar lines which you're hearing from people.
Very rightly said. Like most of the patients are linking it to the COVID effect, post-COVID effect, because they were infected and they are not going for the TB test. And TB test is like it is very difficult to diagnose also.
Yes.
Based on the investigations, these blood investigations are the same, CT findings are almost the same.
Yes.
So as one of our clinicians,
I get your point. Sorry, sir, I'm interrupting you. I'm short of time and I want to include other guests as well. Yeah. This question was to Dr. Mandhania. Let me take the question to Dr. Mandhania because I'm left with just 5 to 6 minutes for the debates and I want to get in other guests as well. Apologies for that. Dr. Mandhania.
This is the very point you had raised, because generally I had seen there are a lot of patients who comes to us with a continuous persistent cough, and they attribute this is because I had this COVID, and this is most probably because of COVID. And generally they are very, very reluctant for getting treatment or investigation done, because they generally the general physicians or maybe the peripheral doctors just attribute it is because of COVID only. So what I feel to say is that generally if it is persistent more than 1 month, if you are getting cervical lymphadenopathy, persistent fever is there, you are getting persistent weight loss even after the completion of the treatment and the derangement of the parameters, then definitely there should be investigation on the line of some other differential diagnosis, because we cannot just attribute everything to that thing. One thing. And second thing, in the malignancy also we have seen 2 patients like this who had persistent cough, and when we they were labeled as post-COVID cough, and when we investigated they were stage 4 CLM. So that means we need to keep our eyes, ears, and our clinical judgment open, and there should be kept differential diagnosis of tuberculosis and other investigations.
Point taken, and a very pertinent point. Dr. Lal, last just one more question. My last question to you. When we speak of women and tuberculosis, the number is rising in urban areas as well. Many attributed, of course, to smoking, a high level of pollutions also, and we're speaking, of course, of the most common tuberculosis of the lungs. Could you shed light on why we are seeing a higher number of tuberculosis patients as far as women are concerned, and preventive measures for the same?
Basically, when we talk about the urban area, because of the overcrowding, because of the pollution, and not the proper nutrition, these cases are rising. If we are getting treated for the women with a full course of anti-tuberculosis treatment, then they will not develop the genital tuberculosis. Therefore, I say the most important preventive measure is that treatment of the abdominal tuberculosis as well as treatment of the pulmonary tuberculosis in the earliest, so that they will not land up in the genital tuberculosis, and we will reduce the burden of infertility in the society.
Right. And when we speak of, reducing the burden overall of TB on society, we know that global efforts as far as TB is concerned, according to, of course, estimates of the World Health Organization, have saved 66 million lives. This is since 2000. Dr. Bhatia, last word to you very, very quickly. What would you say? How much of a contribution did early diagnosis and the significance of diagnosis had in reducing the number of cases?
It's extremely important. That's why I'm stressing on these newer techniques, which at the first contact of the patient with the healthcare worker, they diagnose the kind of TB there is and the resistance there is. That is extremely important because we want to catch all these cases and start treating them. And there are excellent government programs in place to monitor adherence to treatment, so that patients keep taking the proper treatment, and they have to constantly report back that they're taking the treatment, they're adhering to it. So this is extremely important to diagnose it early and to treat it on time, because as we're seeing, the number of multi-drug resistant infections are on the rise, and most of them are these previously diagnosed cases, not fresh MDR cases, but previously diagnosed cases that have dropped out of treatment, or they've not taken the entire duration, or it's been interrupted. So these things we have to avoid. We have to catch them early and treat them properly so that the disease does not spread, does not transmit to more people. That's extremely important.
Point taken. The significance of early diagnosis, the symptoms, the preventive measures, and the various types and stages of tuberculosis. That was the focus. To summarize our discussion, of course, it was a very riveting discussion. Time constraints, of course, ask us to end the discussion here. I'd like to thank all our experts, doctors who took out time from their busy schedules to speak to us on NewsX. World TB Day. It's a day which is celebrated rather to commemorate the significance and to drill home the point on the preventive measures of tuberculosis. I hope we have been able to pass on some of that information to our viewers as well. The theme this time was Invest to End TB. Whether it's going to end zero TB cases, that really is the aim of World Health Organization. If at all it can be achieved, when it can be achieved, especially in low and middle income countries, especially like India, that really is a wait and watch game. As of now, thank all the experts for talking to NewsX.
Thank you.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.